Good morning. In this video, I would like to provide an insight on the American Academy of Dermatology and the International Psoriasis Center concern about the immunomodulatory effect of biological therapy that is used in the treatment of psoriasis during the pandemic of COVID-19. Currently, and until this time, the CDC, or the Center for Disease Control, and the WHO have no guidelines for using biologic therapy during the pandemic. As well, there is no data until this moment of the time for any specific risk with COVID-19 and biologic therapy. A main priority for dermatologists is to keep your patient away from emergency rooms. Dermatologists must delicately balance the risk of using biological therapy with the risk of the disease severity and flare. Therefore, the American Academy of Dermatology recommend that patients should not stop their biological therapy until they consult their physicians. So, to better serve patients and physicians, the Academy is putting forth the following recommendations. There are 3 scenarios. The first one is patients on biologic therapy and they tested negative for COVID-19 and they showed no signs and symptoms of the disease. Here, there is no sufficient evidence to recommend discontinuation of the biologics. However, physicians should weigh the risk versus benefits of using the biological therapy on case-by-case basis. The discussion should include the original indication, the severity of the original indication, the age of the patient, if he is above 60, if he's a smoker, if there is comorbidities like cardiovascular disease, respiratory disease, severe hypertension, diabetes, internal malignancy, all these conditions that might put a patient into a high risk to COVID-19. The second scenario are those patients on biological therapy and they tested positive for COVID-19. And here the recommendations is to discontinue the medication or the biological therapy or to postpone the treatment until they recover. Now the third scenario are patients who are not on biological therapy but are considered to receive COVID-19. And here the recommendations is to discontinue the medication or the biological therapy or to postpone the treatment until they recover. Now the third scenario are patients who are not on biological therapy but are considered to receive biologic therapy. Physicians should assess the risk versus benefit for low-risk patients on case-by-case basis, while other patients who are at high risk, here we recommend to shift to another or alternative medication or therapy. Thank you very much.